Why are ABGs an ICU obsession? In the high-stakes environment of critical care, a patient's status can change in seconds. Relying on physical signs alone isn't enough when life-threatening respiratory failure is looming. These tiny vials of blood provide a real-time window into the patient's internal stability.
ABGs allow us to measure the exact balance of oxygen, carbon dioxide, and pH within the blood. By analyzing these levels, we can guide ventilator adjustments with precision and detect metabolic crises before they become fatal. It is the gold standard for understanding the delicate gas exchange happening inside the lungs.
ICU nurses must understand the why behind the numbers, rather than just memorizing ranges. When you interpret an ABG correctly, you transition from simply monitoring a patient to actively managing their recovery. Ultimately, ABGs turn complex physiological data into life-saving clinical decisions at the bedside.